Hello, everyone. Hope you are all staying well and healthy. My name is Hongmin Li. I'm the James Liang Director of the China Program here at the Stanford King Center on Global Development. I would like to welcome all of you to this special event. The Stanford King Center is dedicated to stimulating research to alleviate global poverty. This requires a multidisciplinary and multifaceted approach. And so all our programs draw from across Stanford campus and the wider community, including you. We at the China program naturally study China. We hope that events such like this can help us to better understand the Chinese economy and its challenges, and to inspire those who work in policy and business alike to think about solutions. Here are a few examples of some past events. So this is Stanford President Mark T. Levine, who speak at the 2018 Stanford China Economic Forum in Beijing, which brought together over 500 scholars, business leaders, and policymakers to discuss issues such as education, AI, finance, and US-China relations. Here's another event. We brought Stanford faculty and leaders to our Beijing campus to meet Chinese business leaders in 2018. We are hosting today's event jointly with APAC and FSI. COVID-19, the economic impact in China. But I think the title downplayed how unprecedented the impacts of the COVID-19 pandemic has been on the Chinese economy. China's GDP for the first quarter of this year shrank by 6.8%. This is the first recorded negative growth since the reform started. This is a country has never faced any economic downturn. For any Chinese who are below 40, they have never seen anything but growth and expansion. Wuhan, the epicenter of the outbreak, was the last city to lift its lockdown in April. But this is not the end of the story. We hear stories of outbreak in different cities in China every week. And most recently, my hometown, Jilin, unfortunately. How has the pandemic affected Chinese society, the health system, and the economy? How serious is the economic downturn? What have been the policy responses and why? Will these policies work, and how will they work? Joining with me today are three colleagues who are leading scholars studying China. I would like to start off by introducing each of them. Carrie Eggleston is a senior fellow at the FSI. She's also director of the Stanford Asia Health Policy Program and the deputy director of APAC at the FSI. She's an expert on healthcare systems and health reform in Asia. And her research has looked at healthcare productivity, equity, and insurance. Scott Rozelle is the Helen Farnsworth Senior Fellow and the co-director of the Rural Education Action Program, also at FSI. He's also a senior fellow at CIPR. I'm also very proud to tell you that he was also, once upon a time, my own advisor at Stanford. Scott has studied China for decades with a major focus on rural China. More recently, he studies rural education, health, and nutrition. His research is extremely influential for China's education policies, and he is a household name in China. I should add that both Karen and Scott speak perfect Mandarin Chinese. Xu Guangzhou is the Gordon Li Professor in Economic Development, a professor of sociology, and also a senior fellow at the FSI. His main area of research is institutional changes in contemporary Chinese society, focusing on Chinese organizations and management, social inequality, and state-society relationships. Xu Guang started to write about COVID-19 on his Chinese Weibo and has over 500,000 followers every day. So here's the plan for today. Each speaker will give 5 minutes of high-level view. Then we will start ask questions to the panelists. All the audience, you may ask questions through the Zoom Q&A feature. You can even start to ask questions now. So my colleagues Tina and Ximi will help us to collect the questions. Okay, now let me start with Xu Guang. So you have studied China's institutions many years. How do you think these institutions affect how the government responds to the pandemic and their policy choices? Xu Guang.
Okay, thank you, Hongbin, and good morning to everyone. So this is a panel about the pandemic impact on China's economy, and I'm not an economist, so I cannot say much about the economic specifics. But as we all know, the government played a very important role in China's economic development in the past 40 years. And so I want to entertain this question, that what kind of policy choices would the Chinese government make in the next round, in the post-pandemic era? Specifically, I want to ask this question: can China renew its reform and opening up policy of the past? Okay, so let me start with an observation. That is, China has a territory the size of entire Europe, with 1.5 times of the population, equally diverse cultural, economic diversities within China. So it is always highly problematic to impose a uniform, centralized authority over this vast and diverse territory. And the centralized political system resulted in what I would call a fundamental tension between the centralization of authority and the effective local governance. So there's always a tension between the two. So one thing China has done right in the past 40 years, it was to give decentralization effort, to make decentralization effort that gives local authorities and private entrepreneurs the decision rights to take initiatives, as we have seen in the past 40 years. So China's impressive economic growth is largely the result of these institutional changes in this direction. But also, as we all know, China has made a significant turn in a different direction in recent years. In this re-centralization effort, the Chinese government has taken the decision rights away from local authorities and private entrepreneurs, and have emphasized over the years the political loyalty and adherence to the party line that often override professional judgment and local decision-making process. And I want to share with you this figure that is the key words that emphasize political loyalty and the party line in the top news items in China over a 5-year period between 2016 to up to the present. As you can see, over the past 5 years, a great emphasis has been put on the importance of political loyalty and emphasis on the adherence to the party lines, up to reach the climax, right to the eve of the outbreak of the pandemic, as indicated by this right line here. That's the eve of the Wuhan pandemic outbreak. So the consequences are obvious and devastating. As you can see from this figure here, that before the January, the red lines divided between this is January the 20th, when the top leader declared the national emergency in organizational response to the pandemic. But before that time, there was no report or no information about pandemic at all. right after that, we can see tremendous political mobilization and organizational response. Okay. So this is what I see as a major issue regarding the Chinese political system, where you have a very highly centralized, mobilized organizational mobility, but at the same time, it can really silence different voices and information flow. And here you see another figure here. This is the major newspaper reports on pandemic and coronavirus. Again, you can see here from the top, this red line here, this is January the 20th. Before that time, there's a very little report or any news about the infectious disease. And right after that, there's a much flow of the reports and mobilizational efforts as recorded in these major newspapers. And in between, as you can see here, this first line is when the Chinese government reported the virus crisis to the international, the World Health Organization. And in between this time until the government declared national emergency, there's almost no report. The only red line here, you can see the report here is from a newspaper in Hong Kong, not domestic newspapers. Okay, so this really raises a question I want to now going back to the issue about what is next. Okay, the economic impact of this COVID-19 in China depend on the policy choices of the government, as we all know. But can China return to the policy of reform and opening up of the past? Okay. Now, historically, after major crises, the Chinese government tended to adopt significant policy turns towards more decentralization and relaxation of political control, as in the past. Okay. For example, right after the Great Famine of the early 1960s, the Chinese government adopted much flexible domestic economic policies. And a similar trend we observed after the Cultural Revolution that opened up the reform and open up era. And then, of course, after the June 4th crisis, we saw a relaxation of policies over time. But is China going to adopt similar strategy or policy choices after this crisis? Or put it another way, can China return to the course of action before this re-centralization effort? And I think it's very unlikely. The global environment, let me put this way, the global environment has changed greatly, and international relations deteriorated drastically for China. And there is also tremendous political pressures, both international and domestic, upon the top leader in China, making it very unlikely, as I said, to adopt open up policy in the foreseeable future. And I think the policy options for Chinese government in economic reopening up is very limited. So with these questions, I want to yield my floor to my economist colleagues and to hear their insights. So thank you, Hongbin.
Thanks, Yuan. Okay. Now, Karen, so you are a public health expert studying China. Can you give us a big picture of China's health system? Has there been any improvement since the SARS outbreak in 2003? Why this happens again and again in China?
Thank you very much, Hongbin, and thank you all for joining us. It's a pleasure to talk with you today. Although it's very difficult circumstances, we hope you are well. So to respond to the question, I'll give a little overview of China's health system, and we'll get to some other questions later. As you all probably know, China's made tremendous progress in raising overall living standards, which has impact on its life expectancy and healthy aging. Since many of the determinants of health are non-medical, you can see here China, which is now in the high-end life expectancy of the middle-income world. Of course, there's a ways to go to world leaders such as Japan or Switzerland on the high end in the OECD. If you're looking for the US here, look back towards China. We're there between the Czech Republic and Chile. Talking about the health system in the PRC, there are many disparities. We'll get to those later, but on average, health has improved greatly. And there have been substantial changes in the health system since the turn of the century, particularly post the SARS crisis of 2003. They dramatically extended insurance towards the 800 million that were uninsured and now have achieved basic universal health coverage, albeit at a low benefit level that they're continuing to strengthen and expand. So like many places trying to achieve universal health coverage, they built upon previously existing plans, such as the compulsory relatively comprehensive insurance for the urban employees, and then added additional plans for informal sector and farmers. So through the voluntary subsidized, less comprehensive insurance plans that are increasingly merged, they include the urban resident basic insurance and the rural insurance, the new cooperative medical scheme. So over this time period, health spending has increased substantially, 6 or closer to 7% of GDP now, absorbing a growing share of China's economy because the expenditure growth on healthcare, both investing in the supply side and in insurance, has exceeded GDP growth. And while 7% of GDP may seem modest, remember, as Hongbin showed us, that China's grown at an unprecedented rate for a long time, and health spending grew even faster. So this is the largest, most rapid increase in healthcare spending in the history of the planet. So the question will be, is that efficiently used? How will that continue? Does it redound to the benefit of all of China's 1.4 billion citizens? A lot of those questions are difficult to answer. Health economists and others have tried to study this. There are many ways to try to measure the impact of health spending. And it's difficult to measure access and particularly quality of care. Here's one measure. One can quibble with the metric, but it shows here that China's made significant progress, indeed the largest increase 2000 to 2016 around the world, if you believe this metric, overtaking Brazil or Russia. So there are substantial regional disparities in that, but on average, substantial increase. So a crisis like this underscores that investment in the broader social determinants of health and also in our health system underpins our society and economy much more broadly. And although the current crisis is very devastating, it would have been even more devastating if SARS coronavirus in 2003 had been SARS coronavirus 2. China learned a lot from that and rolled out universal health coverage, as you've seen other systems in Asia have learned for that, like MERS. So for the future, will evidence-based scientific policies address the weakest links? Because any crisis can strain a health system, and pandemic can reveal the weakest link of the system. I'll come back in the questions to talk about that, but just mention that there's a kind of traumatic stress to whole communities when you have this kind of lockdown, and it redounds to many things besides specific COVID-related conditions and mental health and other healthcare conditions. And only longer term, in the coming months and years, will we know the true excess mortality and other health repercussions of this crisis. Though specifically to COVID-19, the numbers will revise, but perhaps more importantly, other foregone healthcare and prevention, not taking your antihypertensive meds and so on, that data might be forthcoming. We've only recently got data, say, from the US, where you see around a 40% decline in people coming in for evaluation for stroke. We don't know how that plays out in China, but we have seen headlines that remind people you need to come in for evaluation for stroke, and showing the problems of getting access for things like cancer and other things that you can't delay. So overall, we don't know the full long run complications, but we're hoping that a strong, resilient health system in the future will help to prevent future outbreaks of this scale. With that, I'll turn it back over to my colleagues. Thank you.
Thanks, Carrie. So we'll ask you more questions a bit later. So let's now turn to Scott. I know no one knows rural China better than you. I also know that you have carried out several rounds of surveys recently about the impact of COVID-19 on China's rural communities. Can you share with us your research results?
Thank you, Hongbin, and thank you to the thank you to the other panelists. It's a good background. I'm going to be really looking at just a subsector of China's economy. What's the impact on the rural residents? now just a subsector that has 600 to 700 million people in it. And I think that it's also a subsector that's really been mostly overlooked, both in the media, social media, and in the emerging research. And so when we did this, our goal was really to try to understand outside the epicenter, so not in Hubei or Wuhan, where the outbreak was most serious, but in the rest of the rural economy where these 600 million people live, happened to be at the Chinese New Year's when the entire rural population, the migrants included, were back at home. What did they do to control the outbreak? Did it help control the virus? What happened to health, the COVID-19 related health? And then probably our biggest focus, being economists, is what's been the indirect impact on employment, income, schooling, et cetera. And you can see here this is the sample. So 7 provinces around here, 700 randomly selected villages out of here. We tried to get a really good cross-China view of what happened. And we interviewed these 700 village informants 3 different times, exactly 1 month after Chinese New Year's, 2 months, and 3 months there. And I'll be drawing a little on that data. And of course, we couldn't go to the villages to do it, so we had phone interviews. So this is the village informant, and he was telling us what happened in what was happening in his village in the survey form. So what did the survey tell us? What were the control measures taken? Now, this is a month afterwards, but we also asked when were most of these control measures in place. And within a week, 1 week of clamping down, these villages, basically almost all, from 80 to 90% of these villages implemented a whole variety of control measures. From nobody could leave, nobody could come in, you can't have any interactions within the village. Villagers can't go. Children can't go outside and play. So in nearly every of these villages, children are locked in. This is rural China. The houses they're not Adobe, dirt floored houses in general, but they aren't, super nice urban type housing that you'd see in the cities. So there are multiple restrictions, and this is what you see: the locally enlisted militia put up barriers, everywhere. 800,000 villages locked down in 1 week in this thing, and nobody in, nobody out. And these are some photos that our village informants took of their villages. They are absolutely empty, right? This is New Year's. They should be, firecrackers and dragon dances and people partying, right? Okay, a month later, so this is 2 months into the epidemic, you can see China has relaxed those restrictions. They're still there. And I still say 21% of the children still couldn't go out and play. These kids, remember, this is about 20 million children, okay, are locked in their homes for 2 months constantly, right? But the rest of the 80 million kids that are in these villages are now can go out and play. So these have relaxed some, but there still are controls. And if you want to leave, you need a pass to go. It's going to tell you where to go and when to come back. And so you can see that, yeah, I just said that there's still most of the kids can't go out there. These are the same villages in the 10% of the 20% of the villages that kids couldn't go out. There's still nobody out there 2 months later. People are inside. So. Okay, so that's what they did. They took these multiple measures and clamped down in a way that's it's never been done in human history. So what's the impact on the infection rate? Okay, this is the good news. Okay, if they found an infection, if somebody had come back from Wuhan, they advertised to the whole village, stay away from there, right? This is how our village informant knows. Of course, everybody knows everything happens in a small little village like this, right? Especially in the era of cell phones, everybody's related to everyone, right? But they wanted to make sure that everybody knew. So, and because of this, in our 700 villages, in only 6 villages were there any infections at all. And overall, in these 700 villages, there's almost 800,000 residents, about 1,000 people per village. There's only 10 cases. So it's 0.01%. It's 12 cases per million, right? Something like that. And it's really exactly the same as China excluding Hubei. So here's Wuhan, Hubei, 1,000 cases per million. All of China is outside of Hubei is 12. It's almost exactly the same as these villages. These are very similar to, and people have been looking at this, and because they say, well, China underreported systematically. I can't say anything about urban China. We think that this is a good purview of what's happening in these villages. Look at the U.S. California's better, right? But the U.S. is infinitely higher. And the good news: 0 deaths by April. There's no cases reported. There's 0 deaths in these villages, right? So what's the impact on rural employment? This is the bad news. There was a steep price paid for these measures, right? Basically, employment by the end of February is 0. I mean, nobody was working. There's 7 different restrictions keeping them out of the labor force. They can't go to their workplace. If they could go to their workplace, they couldn't get there. There's no transportation. If they could go to their workplace, if their workplace was open and they could get there, they couldn't find a place to stay in the cities. And many, many villagers didn't go because they were afraid of the virus, right? By end of March, so 2 months out, 34% had returned, but 2/3 are still not employed. This means, the rural labor force is approximately 2/3 of China's labor force. This is 2/3, half of China's labor force. It's an unemployment rate of around 50% 2 months out, and it's a little bit better by April, but it's still very, very high. This suggests that recovery for a large fraction of has been and will continue to be very slow. And decline, and of course, what's happened is income's fallen, okay? Almost by 15% of annual average. If you total across the 3 months, it's been a loss of about $200 billion of lost rural wages. This isn't for the whole economy. So this is for a population that doesn't have very much unemployment insurance or anything like that. So that savings for most they do have savings, but for many families there aren't. So how have villages been coping with income shocks? They've been reducing nutrition. They've been reducing expenditures on education. They've been reducing expenditures on the non-COVID-19 healthcare, and reaching out to friends and relatives to cover almost no loans from banks. And there's been 0, since there's no unemployment insurance in rural China, only in 17% of the villages has there been any relief program, and most of that is in-kind food. And most of these are the richer villages. So there's almost 0 government support of this. And while urban China has had a significant amount. There's also a big negative impact on children. REAP, our group, Rural Education Action Project, is doing a lot of work on this. If there's interest in this during Q&A, I'd be happy to share more. So the summary of the findings in conclusion, universal compliance. I think only the Communist Party of China could have done this in that quick and that comprehensive amount of time. And it ended up with very low infection rates. The healthcare system remained largely functional, but the impact has been on employment, income, health, nutrition, and schooling. So I'm going to turn it back over to Hongbin and look forward to further discussion with everyone.
Yeah, thanks, Scott. I know there are many questions queuing here, but before we open up the floor, let me ask my own question first. So here's the question for all three you. So COVID-19 seems to have different impacts on different countries. It also have different impacts for people in the same country. So from your perspective, how do you see the pandemic affect different populations of China differently in terms of public health, economic well-being, and their view about society and government? So maybe we'll start with Karen.
Oh, start with me? Okay, thank you very much. We don't really know the answer to that question in terms of impact on health, but it's likely that the impact will be disproportionately on some of the more disadvantaged groups. As Scott was talking about, there are very proactive, even called draconian measures taken in many systems that suspected that their health systems are weaker, so that offsets the impact on health. But we know there are very wide disparities in China. So here I'm just showing differences in medical technical personnel, mostly doctors and nurses across China on the same scale, but you see urban versus rural is very different across. So there are regional and urban rural differences. And that's just in numbers. And there are also even larger differences according to their training and background. Or here you see beds per capita. And there are very large differences. People might not know China actually has more beds per capita than the United States, but there are large regional and urban rural disparities again there. And those urban rural gaps, you know, they've changed somewhat reform over time, but they're not substantially declining. So additional investment to bring up those least fortunate will help to address disparities in the future. So if you want to look at that same measure of access and quality of care for urban and rural China, if you break out China as a country into urban, looking at the mega cities versus rural, you'll see here on the graph that urban China compares to Korea, Japan, and the US favorably, whereas rural China is very different. And these disparities affect China's health in many ways. So we won't know for sure how that will play out. We know, for example, Hong Kong, arguably one of its most developed cities, has had a very different set of policies. Others might not know that different provinces and cities of each within the national framework undertaken different policies. So we think that there'll be substantial disparities in the way a pandemic influences society and in the longer term trend. We don't know the full answer to that yet. I'll turn it over to my colleagues. Yeah.
Yeah, if the opinion expressed in China's internet is of any indication, then there's really really huge divide among the netizens in China. And this is probably best illustrated in this so-called Fang Fang diary, as a diary written by a writer in Wuhan and recording her observations and her experience about the lockdown experience in that city. At the very beginning of that, when the diary published every day, published on Weibo every day, there's overwhelming support and sympathy for her. But more recently, and there was really strong negative feelings and resentment against her, especially when the news about her diary will be translated into English and German. But I think we should be careful about the mood among the netizens in China, because sometimes and oftentimes it is more likely that one group is given more voice to express their emotions, their feelings because of the government censorship, whereas the other groups the voice of other groups has been silenced. So I think without a balanced expression of opinions, it is really hard to tell what is the extent of divide in China. But that divide certainly exists.
Scott.
These are really good questions. Just on, Karen did a great job of looking at differences in the health system between rural and China and urban China. I think the one part of there that needs to be added is most of those metrics are sort of physical doctors and expenditures have come out. What we've actually seen in studies of China is that although expenditures have gone way up for rural healthcare in China, is health in rural China has not. It's almost steady. And our group has been doing a lot of work with Chinese collaborators. And what we're finding is that the quality of the healthcare providers and it's the training of them is so low that that they get very, very poor quality healthcare. And I think that's going to be China's one of their major challenges in the coming future. That's why I say, oh my gosh, what a great thing that there wasn't big COVID outbreaks in these rural areas, is that they weren't faced with trying to deal with that. I don't think they could have. So that's the sort of the silver lining, benefit of that. The other biggest impact is really on education of children, right? In cities, right? Everybody has internet, everybody has a computer, everybody or large shares of people have printers, and parents are home and parents are educated. Teachers immediately went online, started giving, one-on-one, one teacher to one set of class instruction on Zoom like this, right? Like we've been teaching, Hongbin and I are co-teaching. That's what the urban students got immediately. And then the parents paid for tutoring and for other online things. That was what happened in urban China. I don't think that they lost hardly a beat. But if you go to rural China now, in China's defense, they did an amazing job of rolling out online education for the kids. In almost 80% of the villages, immediately within 1 month, they were giving online courses for kids in math, in Chinese, and English. I have to go, we have a whole body of work that's coming out on this, but the bottom line is, of course, is that almost only 1 out of 10 families either had a computer or an iPad. So most of them it wasn't on a nice cell phone like this. It was a small little local smartphone that they were trying to do. 50% of them, you couldn't go out, they weren't allowed to go outside because of the quarantine, but you couldn't get a signal to get online unless you went outside. And so there was this tension. So when we ask parents, what was the impact of the COVID virus on education of your kids, over 90% of the parents said it was either very serious negatively or relatively serious, that basically kids. And so that divide is China rolled out rural education online better than any other poor or middle income country in the world could have, but it wasn't enough. And this gap between rural and urban, I'm sure, has expanded from this last semester of learning.
Okay, thanks, Scott. Okay, now I'm going to read some of the questions from the audience, actually. I'm going to read 2 questions. I think they are related. The first one is from, actually, Bob King. So his question is, in what areas may the US and China collaborate? How about climate change? And another question from Shamin. The question is, how will US-China relations evolve? I think these questions are related. So, Scott, do you want to answer first?
I'll answer Bob's question first. I think it's absolutely imperative that we look for ways to interact right now, and a healthy U.S.-China relations, is going to mean lots of positive things for China and lots of positive things for the U.S. and lots of positive things for the whole world. And certainly what we need to do is to find areas that we have mutual interests and that don't have the political tensions like climate change and the environment. But I think academics can take a big role, and in really support of our administration here at Stanford, even over the past year and a half when frictions have been very high, they have told us, full support. Stanford 100% supports interaction with our Chinese colleagues. That there's caution in these very small areas that might really have secrecy or high tech concerns that, I'm an economist that works on rural China, but, in the 98% of academic exchanges that we have, we should push forward with those. And so I think that, this is one thing we can proactively, work.
徐光, do you want to?
Yeah, I think there's a huge uncertainty about international relations as this in the post-pandemic era. My sense is that there's deep suspicion and distrust on both sides, and this will play into, I think, towards the presidential election in this country. Until that is settled, probably this relationship is still undergoing a lot of tests. My sense, I very much agree with Scott. I think, first of all, 2 points. First, I think it's tremendously important that the two countries find some common ground to move forward with positive exchanges. Will not let the relationship deteriorate. And I think the second point is that the academic exchange played a very much important role in this process. And this is already taking place in this pandemic crisis response. That is, medical professions have exchanged a lot of opinions and come up with a lot of common responses, strategies. I'm just hoping that we as academics also contribute to that process, that moving this, hopefully, relationship towards a positive notes.
Karen, do you want to add anything?
Just to echo my colleagues that I think there is a lot of scope for productive collaboration. It is in the interest of Americans and globally to have a strong and resilient health system in China, as this crisis underscores.
Okay, great. So the next question is from Alice Han. I think she's my student. The most recent growth data released on Friday suggests that China is much better at ramping up industry output and production rather than consumption. So given the importance of consumption to growth, how optimistic are you about government policies to kickstart a V-shaped consumption recovery? Or do you think the household savings rate will remain sticky in spite of incentives like consumption e-vouchers? This is an economic question, actually.
Let me take a quick shot at a little part of that. That's it's a very deep question. What I want to warn people on, and I, ran through my slides very fast. I'm still over time, but it was that I'm not sure we're seeing a V recovery of the end of output, of production. Be careful what you're looking for. If half of the economy, if half of the labor force or 40% of the labor force is still not working, we aren't back up where some of the numbers say that they are. And so, I think that, I think that people should know about that and they should deal with that, number one. Number two, you see why people are going to not consume, right? I mean, if you have big impacts on your income and you don't know what the future holds and you have small amount of savings, you aren't going to consume, right? And I think that's exactly where they're doing. Urban China is now going to a system where they're giving out consumption coupons, right? It's actually the government giving consumers money, but they have to consume with it because they know if they give them cash, they'll save it. And I don't think that doesn't solve the underlying problem.
Yeah, I think that's a very good answer, actually. Actually, I can also help with a little bit this because I have worked on this a little bit recently. Many people have been talking about V-shape, or U-shape, or W-shape, or L-shape. They could be different shapes. But what we saw is that in the data, there's a recent data showing that actually during the pandemic, Chinese are saving more, spending less. So why? I mean, there's a huge uncertainty about the future, especially about unemployment. So people are actually saving more. Giving them some vouchers doesn't help because the vouchers they used to consume to buy food, so they will save their cash, right? They don't use cash to buy. So that basically crowds out the existing consumption. Doesn't help much. I think to help them, I think creating jobs or keeping the unemployment rate down is more important, I think. Okay, let me read more of the questions. The next question actually is from our colleague, Michelle, actually. This is a question to Karen. So you spoke of excess death from other units because people do not receive necessary care or prevention. But what of the death transfer from, say, heart condition or chronic conditions to COVID-19? Do we know what proportion of COVID deaths are displacing other common causes of death among the elderly?
Well, thank you for the question. And just to tie it to the previous one, just to note, China is very elderly and its population is aging quickly. Median age in China is actually higher than in the US, and this affects many aspects. We know that elderly are more vulnerable to this particular pandemic, and having comorbidities is a risk factor. That said, many of the people that have perished have been younger. You know, Li Wenliang was in his 30s and Liu Zhiming was in his 50s, because that's happened at the epicenter. So only longer term will we know if we age and sex adjust the excess mortality, will we know. We know every flu season takes away many older individuals who are already vulnerable, but there's a lot of premature mortality related to this. Some of the deaths may be miscoded, or there might be other kinds of care that are foregone that will have longer term implications. So in some sense, yes, there was a transfer. I mean, Li Wenliang would have died from something else eventually. None of us are immortal. But the decrease in healthy life expectancy may be significant. And that's why controlling the spread, even with draconian policies, may have had significant impacts. Of course, there are trade-offs in terms of the total death rate. We know that there's less air pollution and fewer traffic accidents, but then there's all this foregone care. So only longer term will we know the overall impact. Thank you for the question.
So the next question is from Tongxin Cai. So the question is, compared to the high economic cost of China's policy of COVID-19, what aspect should the US learn or not learn from China, applying to the US actually, I think?
Well, mutual cooperation, we can learn that a small investment in proactively preventing a pandemic can have large social and economic benefits later on. And we need to think about cost-effective ways of promoting healthy aging. Maybe there's some mutual learning there. But there are many other aspects of the questions I can't address.
Yeah, yeah. Two countries couldn't have addressed the same outbreak in two more different ways. You know, I think that, you know, the lessons are, right, is that, you know, I think the lessons are is, you know, if you really, really clamp down, you can reduce the, you know, the outbreak, the incidence of the disease, but the economic impact is equally or perhaps even bigger than, you know, than it is here. Of course, we aren't through it yet, and China's not through it yet. So I think that it's a long ways to go before we can ask that very, very good question.
Scott, here's another question for you. So what effort do you anticipate that the government will implement and help with rural unemployment and the economy in the near future? This is from Bill Kwong.
Yeah, I mean, what the government's doing now is they're hoping and praying that this it's, you know, whether it's a U, that the U doesn't turn into an L, right? You know, that recovery will continue to help. And the strategy so far is just let the rural economy live on their own, let them survive, and, you know, try, you know, you know, this is, we're going to focus on getting the factories back up and running, and we'll hope they'll trickle over, right? And at the same time, the only real help that they're getting right now in villages is they're giving them massive, that's to 200 million farms are getting small, but times 200 million is massive, subsidies for fertilizer and for seeds, because they want to make sure the crops get in the ground, that there's no food security problem for the urban economy, of course. So they're doing that. I don't think the government has a good plan. There's no system in place, because social policy, including unemployment, education, health, ultimately rests with the locality, with the county. And these counties have no income. They aren't getting any transfer. So there's really nothing they can do. Until if we see 30% of the unemployment persisting for months and months and months, I don't know what the government's going to do. Are they going to start issuing unemployment certificates to? Wow, I mean, that would be the biggest shift in social policy. So, I mean, I think that it's just this completely black box that that people are talking about, but there's no solution in sight yet.
Okay, so here's another question. How do these very low infection rates show for rural China compared to European countries? The Hubei province also had higher infection numbers despite the shutdown. What are other factors explaining the low infection rate in China's rural areas?
I mean, I think it's just the clamp down, right? I mean, and right. I mean, so think about this. Here's all of China, and right here is Wuhan, and that's where it came from. And what are there? 5 million workers from all over China in Hubei, and the infection is bubbling through this economy, and then New Year's happens and everybody goes home. What we see is there are hot spots in certain economy, like Wenzhou, southern Zhejiang was the second biggest hotspot in China. That's because 1 million of those workers from Wuhan went back to Wenzhou. And so the infections were very high. This is like, that there were lots of Chinese workers who were going back after New Year's that went back to Italy. And that's why Italy broke out so quick. That's the hypothesis, right? And so we have the big hotspot there. While the rest of these 4 million people go out, right? There's 2 people to this village and 4 people to that village. And because China clamped down so quick, they caught them, right? They went around and took the temperature of 600 million people in 3 days. Within 3 days, 600 million people, and anybody that had a temperature got thrown right into quarantine. And so, that's why it was so low. And certain hotspots happened because they had these very close relations with Wuhan.
Actually, there are so many questions, actually, over 40 questions now. I think we have about 5 minutes. So maybe let me read the last question. And then you also give your final remark. I think this is a very good question for the final remark. This question is from Yabo, actually. So China, as well as other Asian countries, such as Korea, Singapore, seem to have done a solid job containing COVID-19 spread and gradually resuming businesses. The theory is that the Chinese political system is inferior to a free country such as the US in countering the crisis. So in light of these US-China experiences in today's pandemic, has that view changed? And how should each country improve? Maybe each of you give a quick remark. Zhuguang, do you want to go first?
Yeah, so let me put this way. I think the centralized system in China is very good responding to this kind of crisis, the pandemic crisis, because it requires first quick response. Secondly, you want to control the flow of people, flow of individuals. where that system has been designed to control individual mobility in terms of physical, in terms of jobs, and also locality. So there's a hierarchy of organizations built into that society to control people's mobility. So yes, indeed, in this kind of pandemic crisis, I think the centralized authority like the China system works really well. But we should remember that the same kind of centralized authority also created the Great Famine of the 1960s, because the local government, all the organizational capacity can limit people's mobility and information flow. And that created this kind of crisis in terms of information signals about the shortage of grains and about the extent of the famine. So in many ways, I think the current crisis is one unique instance that favors one type of mobilization. But as I showed you in my slides before, that kind of system can also block information until the last minute, until it's too late. So in that sense, there's also problems with that kind of system, and we should keep that in mind.
Yeah, I mean, I think that you know the Chinese system, what we know, one party system without any voice for different parts of society. Rural people have no voice. They've got zero support. We're going back and forth here over how much of the $2 trillion goes to directly to poor people and how much of it goes to big companies, and we're fighting constant. At least there's a voice there, and I think that that shows us. And is it, as you saw? I mean, only 10%. So only 60 million people have less health care today. I mean, I'm sure there were thousands of deaths from 50 million people not seeking health care in the last 3 months in response to and so I think that there is another fundamental difference, of the system.
Harry?
Thank you. My colleagues already shared very important views. I just add that even before this crisis, China was facing many challenges this coming decade: population aging and slowing economic growth. And this crisis will compound many things. I mean, we have very low retirement ages in China. Well, this gives a perfect excuse for companies not to deal with elderly people, because they are also at higher risk. Women have seen large change in their position in China, but then they're easy for it to again have the presumption, well, you need to go take care of the kids, especially when they're in lockdown. So there are many longer term trends for the economy and society as a whole that we'll have to follow, and how China responds will shape the world and their generations to come.
Okay, thanks, Karen. So before we close, I would like to thank my colleagues Karen, Xuguang, and Scott for sharing their insights about China. We would also like to thank the staff members of the King Center, let me show your pictures now, who have been working on this tirelessly in the past few weeks, including Tina's here, Ximin, Colin, Eric, and in particular, Leslie, who is the mastermind behind this whole event. Thank you all for joining us today. I know there are so many unanswered questions. We will do this more often in the future. Thank you all.